On in a few minutes. Excited at what we'll learn again today. I still can't get over that microplastics in tea.
I stopped drinking tea because of that.
No, it didn't say we should stop drinking tea.
Yeah, but in the
It was suggested that
in the bag, in the tea bag.
yeah, yeah. That
Yeah. So
good tea, yes. So, welcome everyone. Welcome to Medical Mondays with Dr. O. And to a new week, exciting week. Dr. Tony Okwesomi, a family practitioner in Maryland. I treat HIV and addictions. I treat everything, actually. I love it. Anything that walks through the door. You know, they call us gatekeepers. And I actually like that too. Enjoy that, but I love learning and enjoy imparting knowledge whenever I can also. So tonight, we have our very own Omo. Our very own Dr. Oluwole Omowole, right? Ajagbe. I want dentists now who is going to, impart into us again some knowledge. And so, because I know that Dr. Ajagbe would love to take time, I'm going to defer to him and not waste any more time. Dr. Ajagbe, welcome and welcome everyone to Medical Mondays with Dr. O.
Good evening, everyone. Welcome again to another episode of Medical Mondays with Dr. O. Today, we're going to go into an area which often probably never talked about, and because the direct connection between the two don't seem to become very obvious to everyone. But tonight, let's just talk about the link between oral health and peripheral neuropathy. For those who may not understand what peripheral neuropathy means, it means the derangement or the condition whereby the peripheral nerves, that is the nerve endings in the hands and the feet, or the arm and the legs, seem to become frazzled and become deranged over time. We know sometimes it's been associated with debilitating conditions like diabetes, but tonight we're going to see how oral health conditions can impact all the different aspects of health, and particularly peripheral neuropathy. I know when we talk about oral health, and everybody just thinks about cavities, some people just move away from cavities and start thinking, also about gum disease. But anything that goes on in the mouth impacts the whole body. The mouth is the gateway to the body because of the way it is structured. The mouth is, the formation of the mouth is linked to the airway, without which nobody will be alive. If the airway is completely compromised because of something going on in the mouth, the individual would definitely be dead. So the mouth is very, very important. We've seen this over the years since the oral health America by David Sacher, the Surgeon General at that time. We now know the report is constantly being cited to connect oral health with overall health. So tonight, let's zero in on the peripheral neuropathy, which affects millions of people all over the world. So poor oral health. I'm sure everybody thinks it has to do with dental issues only, but we have found out over the years with research and many pieces of evidence to support that it can affect every aspect of the body. Anything that goes on in the mouth that is abnormal would definitely affect other parts of the body. So this presentation today is aimed at exploring how oral health may contribute to peripheral neuropathy, a condition affecting nerves in the extremities. For those who don't know what extremities means, it means the arms and the legs. So how does this happen? How does oral health oral diseases seem to present in other parts of the body as illnesses or conditions that are not very conducive for overall health. The first thing that happens is anyone who has very poor oral health, that is, they have conditions like gum disease, gum infection, generally that is not controlled is a very bad situation for anyone, because that causes what we call bacteremia. Whether they are chewing their food or brushing their teeth, bacteria from the infected gums will go inside the blood cell, inside the bloodstream. And once it gets into the bloodstream, it elicits what we call chronic inflammation. Chronic inflammation is not specific to one place. It's generalized once it gets into the bloodstream. And you will see as we go along today how they are all connected. So when there is chronic inflammation, the systemic effect of chronic inflammation is far-reaching than just, having bad breath and bleeding gums and all of that. So, gum disease definitely will lead to chronic inflammation once there is bacteremia, that is bacteria in the blood. Bacteria from oral infections can actually not just enter the bloodstream, but cause systemic response all over the body. And that has been documented by many research data that shows that every one of us, whether we have gum disease or not, have occasional bacteremia whenever we are brushing our teeth or chewing something which is crusty. Anything that can cause us to puncture the mucosa can introduce bacteria into the bloodstream. So, but what we are concerned about tonight is the chronic state of inflammation, all over the body that can actually contribute to nerve damage, which may lead to peripheral neuropathy. Now, chronic inflammatory process all over the body, including all the organs and systems, will present in different ways for different systems. When it affects the nerves, it causes the damage of the nerves, and the nerve conduction will not be, up to par any longer. And sometimes it will present as tingling sensations, burning sensations, other forms of, feelings that are not normal in that part of the body. And when we concentrate on the extremities, that is the arm and the legs, then we can say that this is actually the presentation of peripheral neuropathy. So now, what are other conditions that can contribute to this to the severity of the peripheral neuropathy? We all know that oral health and diabetes has been established. It's a two-way street for them. Anyone who has uncontrolled diabetes is prone to have gum disease. Gum disease from this, and even cavities will be, the incidence of cavities and gum disease will increase in anyone who has uncontrolled diabetes, as well as anyone who has uncontrolled gum disease will also go in the direction of diabetes over time because of the generalized inflammatory process, which will affect the pancreas and other, particularly the part of the pancreas that secretes insulin. Also, we have found that people that have diabetes are more prone to gum disease and tooth decay because of the higher sugar content of the blood. Because once the sugar content in the blood is higher than normal and it seeps into the mouth, where there's a plethora of bacteria, particularly the ones that are very dangerous to our health, they will multiply quickly because they love sugar. They love sugar and they hate oxygen, so they grow deeper into the gum tissues, and that is why diabetes actually makes gum disease worse in any individual who already has gum disease. So we now know that if somebody has very bad gum disease, if it's controlled, it will affect the diabetes response to therapy. So our goal from this, just learning from this tonight, is that if we can control oral health, and diabetes can be controlled, particularly in those who already are diabetic, the tendency to move in the direction of the complications like peripheral neuropathy will be minimized. So we are, looking in that direction to control the presentation of peripheral neuropathy. So oral infection doesn't only affect diabetes. We know that nutritional deficiencies can result from oral infections. How does that happen? Oral infections can cause, gum disease in the sense that there will be pain, the teeth may become loose, or there will be premature loss of teeth, which then means individuals are not able to eat the foods that actually give them the kind of nutrients that prevent nerve damage. The nutrients that specifically affect the nerves are the B vitamins, particularly vitamin B6 and vitamin B12, both when they are lacking in diet, and they are most likely going to be lacking in diets of anybody who has uncontrolled oral infections that lead to not just gum disease, but loss of teeth or difficulty in chewing. This will contribute to the formation of nutritional deficiency of vitamin B12 and B6, and that will lead to nerve damage that we see in peripheral neuropathy. So you can see that oral infection, though it may seem so localized in the first instance, could be far-reaching when it's allowed to spread without any control. So what other ways can the mouth influence the presentation of peripheral neuropathy? Another way by which the conditions of the mouth will affect the occurrence of peripheral neuropathy is in autoimmune conditions. There is one autoimmune condition that specifically affects the oral environment, that is the mouth, and that is, the dry syndrome or the Zika complex. We call it Sjogren's syndrome, but I don't think you should try to remember that name. But anyway, the condition creates an environment where the teeth get more decayed because the mouth is dry. These individuals that have the syndrome, they have dry mouth, dry eyes, and if they are female, they have the dry mucosa of their vagina and all of that stuff. So this condition can present not just the dryness, but predisposition to chronic infection. So we found out from research that people with Sjogren's disease definitely will have increased formation of plaque, increased formation of plaque will cause increased decay of the teeth. And gum disease is also part of the equation. And so both poor oral hygiene and peripheral neuropathy may occur due to the underlying autoimmune condition in this case. So anyone who is experiencing dryness in their mouth and dryness of their eye, they need to get investigated to know what the underlying cause may be. Now, those who are dehydrated can choose to hydrate over a period of time to reestablish the water content of their system, and that may seem to improve it if their dryness is not due to the autoimmune conditions. Another way by which the oral disease or periodontal disease, gum disease, can predispose to peripheral neuropathy is through the cardiovascular diseases. Over many presentations, we've repeated several times that periodontal disease is associated with cardiovascular problems, which can affect nerve function. Now, how does this really happen? We know that when there is poor cardiovascular health, that can reduce blood flow. Because we already know, we established that in previous discussions that bacteria, particularly P. gingivalis, which is the very bad bacteria in the mouth, has been associated with the plaque formation in the blood vessels, which causes the narrowing of the blood vessels. And the narrowing of the blood vessels may not be only in the big blood vessels, may also affect the smaller blood vessels, including the ones perfusing the nerves. So by having poor circulation, poor vascular circulation blood circulation to nerves, we know the nerves will become damaged. So, and that, in a way, indirectly, periodontal disease leading to cardiovascular disease can lead to peripheral neuropathy. Another way by which we will establish the problem between the link between the oral and the neurological systems is through the oral microbiome. Well, oral microbiome refers to the micro organisms in the mouth maintaining a balance. That is, you have both the good and the bad bacteria in the mouth, and they seem to populate the mouth in such a way to maintain health. The good bacteria seems to overpower the very pathogenic bacteria under healthy conditions. But once the conditions are conducive to the growth of the bad bacteria, they take over. That's the reason why somebody who has diabetes with very high blood sugar, who has bleeding in the gums, will have more severe, gum disease than somebody who doesn't have, diabetes, for instance. So if there is any shift in the balance of the microbiome in the wrong direction, it would definitely cause vascular problem. And we've seen that in many cases when the oral microbiome is shifted due to the use of antimicrobial or antibacterial mouthwash, which I shared a few presentations back. In that case, the blood pressure goes up. The blood pressure going up affects everything else. And then, of course, with the seeding of the bacteria into the bloodstream, causing atherosclerosis, all of these combined together make for damaging of peripheral nerves. So once the nerves, the nerves in the extremities are compromised because they are not getting enough nutrients, because the blood supply to those areas have been compromised, the nerves becomes irreparably damaged. And in most cases, it's very difficult to control or to treat. So now, if we follow the steps that we've taken, they're not all complicated, but they are often being overlooked. When somebody is said to have tingling sensations in their extremities, that is their hands, their feet, many people can't sleep at night because they woke up from their sleep because of the tingling sensations and burning sensations of their legs and their feet. This is different from restless leg syndrome. That is totally different. So there are people who, because they are not able to sleep well at night because of this condition, lapse into all kinds of other vicious cycles. They will have excessive daytime sleepiness, even though they may not have obstructive sleep apnea, but because they haven't slept well during the night, they will still have the same kind of presentation. So from a dental standpoint, we are looking at everyone who has very poor oral hygiene and poor oral health. That is, we can see that they have gum diseases. We need to work them up. We need to alert them to the potential danger that looms around the corner if they are not controlled. And thank God that we have simple ways to control the gum disease. If it's diagnosed early, antibiotics can be given to reduce the bacterial activity. And of course, at home, the oral hygiene maintenance can be conducted by using baking soda and hydrogen peroxide, and this would neutralize all the acidic environment in the mouth and reduce the virulence, that is the toxicity of the bacteria in the mouth environment. So let me just conclude by saying that I've established tonight that poor oral health can indirectly contribute to development or worsening of peripheral neuropathy. All right. So if we can address oral health, which is a crucial part of managing every part of the body, then I think we will succeed in reducing the presentation or the severity of peripheral neuropathy. Thank you.
Wow. Thank you so much, Dr. Ajagbe. Before I even say anything, I want to say that on this platform, we don't establish physician-patient relationship. We share knowledge, we learn, and we grow from it. Thank you so much, Dr. Ajagbe, for that presentation. Who would think that poor oral health would cause neuropathy or worsen neuropathy? Again, neuropathy is when one feels numbness in their hands and feet. And, neuropathic pain is not fun pain. I don't know if anyone on this platform have had shingles, and then they have something called post-herpetic neuralgia, which is neuropathy that follows, some episodes of shingles. It's horrible pain. So it's numbing pain. It's not fun. I have a question on the forum, in the chat box, from Dr. Morenike Oyenusi, our attorney. She says, Dr. Ajagbe, are you there?
Yes.
Your camera is muted. Thank you. If your oral health and blood sugar levels are fine, what else can cause chronic inflammation leading to peripheral neuropathy?
I'm sorry, I don't know why I can't see my 1 second.
No problem.
I'm just trying to see. I can't see myself anymore. So I'm trying to know what happened. View.
We can see you.
Yeah, I
You
know. Okay. All right. But I can see me, so I don't know whether.
you're clear, you're fine, and we can hear
Okay.
you.
All right. Thank you. All right. So, can you repeat the question, please? I'm
If your
sorry.
oral health and blood sugar levels are fine, what
Mhm.
else can cause chronic inflammation leading to peripheral neuropathy?
Well, any time there is can you hear me?
Yes.
Okay. Anytime there is bacteremia, bacteremia meaning bacteria getting into the bloodstream, even people with good oral health, but if their immune system is compromised at some point, it can lead to that. If you have controlled blood sugar and your oral hygiene is very good, the chance of having a peripheral neuropathy connected to the oral condition is very slim. Now, what are the other situations that can present, that can lead to peripheral neuropathy? The most likely is nutritional deficiency. Uh, Particularly for those who are vegetarians, who do not eat any meat, who do not eat any type of animal protein, vitamins B12 and B6 seem to be found in more readily in animal, products. So those people will have to use some kind of supplementation, particularly once they begin to feel numbness in their feet. They are feeling very funny, in their arms. They should, first of all, seek advice or seek counsel by consulting with a primary care physician who might do the blood work and check for the vitamin B, uh, levels. And with that, if it is very low, the treatment is very straightforward. It's just by supplementation.
Thank you very much. Yes. When your oral health is great and you don't have diabetes, as Dr. Ajagbe said, when it comes to the linkage of oral health to peripheral neuropathy, these chances are slim, correct? But
Yes.
there are many reasons why one can get peripheral neuropathy: alcoholism, any inflammatory condition, trauma. One can hurt oneself. And if you damage a nerve, when you hurt yourself, then you would have that neuropathy. Some medications also can cause it, especially chemotherapy.
Yes.
A lot of people on chemo, would have peripheral neuropathy. Some medications that we use to treat, heart conditions, even antibiotics, some antibiotics can cause it. And, I said chemo can cause it. Some cancers themselves can cause peripheral neuropathy. Um, Exposure to some chemicals can cause it. There are lots of things that can cause it. There are several viruses also that can cause peripheral neuropathy, like Epstein-Barr virus. You don't need to remember those things. HIV, I treat HIV. Some people can have peripheral neuropathy from there. Even herpes.
Yeah.
Herpes simplex,
Shingle.
shingles.
Shingles.
Yeah. Mhm. Yeah, I talked about that, a minute ago. There are many things that can cause peripheral neuropathy, but what is really interesting and, that may be new knowledge for most of us is that oral health can actually cause peripheral neuropathy. So taking care of our oral health is very, very critical. It's important. I mean, I've
Yes.
talked so much on Medical Mondays with Dr. Ajagbe and, other dentists that have presented on things that are just amazing that we may not realize are linked to our oral health.
Yes.
So our own financial guru, Mr. Emodi, kindly unmute.
Thank you
Yeah.
so much, Dr. O, and thank you for the information, Dr. Ajagbe. I was wondering about the role that the tongue play as part of the overall oral health. That's the first part of my question. The second part is if there are any critical role that the tongue plays, how do we then make sure that we're taking care of the tongue specifically?
Well, the tongue is a very important organ in the mouth. The tongue is a muscular organ. And if you know, there's hardly anything that we're doing in the mouth that the tongue is not involved. If you just want to lick your lips to be sure that your lips are not dry, you need your tongue. You can see, I can do that to make sure I don't have excess saliva in the corners of my mouth. Why is that important? If you have excess saliva in the corner of your mouth continuously, if it's constantly wet, because your vertical dimension, that is, your bite has collapsed. You see the corners of their mouth are constantly creased and wet. It will become infected. It will become infected primarily by bacteria. So the tongue is very important. The tongue goes there and cleans it to make sure that place is very healthy. So starting from outside, you can see the tongue is beginning to be very effective. Controlling the corners of the mouth, the lips themselves. If the lips themselves are dried and cracked, there will be problem. So the tongue helps to moisturize. So every time you're talking and you feel your lip dry, occasionally you just go like that, right? Because the tongue recognizes the importance of lubrication of the mouth. The lips seals the mouth to become healthy. So if the lip is not sealing the mouth to become healthy, the tongue gets the bulk of the insult. Why would that be the case? When somebody is a mouth breather, the tongue is the one that receives all of the big insult of the germs coming through the mouth. Because the tongue is bigger and is right in the middle, any air that is going into the larynx through the mouth for a mouth breather passes over the tongue. The tongue is not smooth. The tongue has like finger-like projections sticking out above the tongue on the surface. So that traps everything because the tongue itself is wet. It traps things that comes in that are not very healthy. Now, the reason the tongue now becomes very important is that the saliva that comes in from the salivary gland, they contain immunoglobulins. Immunoglobulins are antibodies that the body produces. And that will cause the tongue to mix the saliva with those germs, whatever it is, to be swallowed. So when the saliva swallows it, saliva mixes with that, the tongue pushes it to the back, it goes to where there is acid, hydrochloric acid. So that constantly just sterilizes whatever is contaminated coming from our mouth. All right? So the tongue itself keeps the mouth clean. The tongue will find the finest, I don't know how to describe it in a layman's term. The thinnest abnormality on your tooth surface, the tongue will find it. If you just brush your teeth and then you use your tongue after you rinse your mouth, you go around, you can find all the smooth surfaces. But if you miss a spot, the tongue will tell you right away, boom, you missed this spot. So the tongue is very, very valuable in not only maintaining the health of the oral cavity, but it helps to be like a gatekeeper to make sure that the oral environment is in a healthy state. Now, the tongue itself can become infected. All right. The tongue, if you beat your tongue by accident, you are chewing, you are distracted, bang, you beat your tongue, you feel some blood in your mouth. If you don't do anything and you have very normal immune system, your immunity is intact. Within 3-4 days, that puncture should heal. Without you doing anything, without you putting any medication, no antibiotics, nothing. The tongue will heal itself. But if the immunity is down and the mouth is bumped out as a mouth breather, the tongue puncture will become infected. And they may need antibiotics. And things like hydrogen peroxide would then be very helpful. If you now use ordinary mouthwash, not only are you not going to get the kind of result you are looking for, you will also cause the blood pressure to go up. So the tongue is very, very important. The tongue keeps the mouth clean. The tongue helps you to swallow. The tongue helps you to speak. The tongue helps you to express emotion. The tongue helps you to stay alive, because every time you fall asleep, because the tongue is attached to the front of the lower jaw, if you fall asleep and your tongue goes to the back, because the tongue is at rest, the muscle relaxes, the tongue falls to the back, blocks the airway, the brain wakes you up and causes you to move your lower jaw forward. See, if the tongue is not attached appropriately, can you imagine what is going to happen? Yeah. Many people will just fall asleep and die. So the jaw with the tongue attached to where it's supposed to be, the combination is perfect for survival and healthy living and very good quality of life.
Thank you so much. A lot of information. Thanks.
Does that answer your question?
Are you kidding? Over and above.
Fantastic. So I have another question in the chat box. What about teeth grinding if your oral health is otherwise fine?
Well, I have another topic on that, which is parafunctional disorder and mental health. Anyone who has everything going well for them, but they still grind their teeth, the first thing they must do is see a dentist. If a dentist tells you your teeth are crooked, like you didn't know that before, you've seen it in the mirror, you've seen how crooked your teeth are all crowded up, and the dentist tells you, I can't do anything about this. He says, but I'm grinding. I'll be very shocked that any dentist will tell you they can't do anything about it. Because there's something that can be done about that. The first thing to do is to recognize the growth of the jaw. What is the growth? Is the jaw underdeveloped? If the jaw is underdeveloped, then there is help. The jaw can now be grown. We can now assist the jaw to grow to full potential. The technology now exists. And I've presented that in this forum before. And if there's any opportunity to repeat that, I could do that for those who were not here before. So if you are grinding your teeth, it's telling you something. Your teeth are not balanced. If you grind your teeth, it means some teeth are touching before the other. So you are trying to make all your teeth to touch, which is the reason why many people grind. Other people grind their teeth, even though they have very good oral hygiene, they have everything else looks okay. They grind their teeth because they have sleep apnea. anyone who has obstructive sleep apnea has the potential to grind their teeth. One, because when they fall asleep and the tongue and the soft palate collapse and they block the airway, the brain wakes them. Within 10 seconds of no air going through, the brain will wake them up to say, breathe again. And the most people, the first thing they do is to move their lower jaw forward without being awake. They are not awake, they don't know they are doing this, and that causes them to move their teeth over one another. By the time you do that 10 times per hour, and you sleep for 8 hours, you ground your jaws, your teeth 80 times without you knowing that you have done anything. You have no idea you are doing all of that. Because when the brain wakes you up, you are not fully conscious. It arouses you to the level where you can at least move your jaw so air can go through. And for those who cannot easily wake up by just sliding their jaws, the brain will stimulate their bladder to let them feel like they have to go and pee. So they will now get up from where they are to go and pee, and they get to the bathroom, they'll do only a few drops. Nothing else comes. Then they go back to sleep. The tongue goes back the same way that it did before. The brain wakes them up again to go and pee, because there is no other way for them to start breathing again if they don't get aroused to the level of, opening their airway voluntarily. The airway will not open voluntarily if you don't open it by yourself. So grinding is a big problem. If you don't do anything about grinding, once your bite collapses, as you grind, your teeth become shorter. And then you'll be losing bone along the gum line. Even though your teeth are getting shorter, but when you smile, the teeth will look longer. Because you have lost bone, more of your roots are now showing. There is a condition that we call abfraction, which means the enamel along the gum line begins to chip off. So now if you put a fingernail on the gum line, you can catch the edge of your tooth, which shows that there is a gap. Part of your tooth is breaking off because you are clenching and you are grinding. If you don't do anything, that tooth will continue to get deeper. The chipping up will continue to get deeper until the tooth can actually snap off, because there's no more support. So grinding is not a fun thing. Many people deny it, but I tell them, when I look in your mouth tells me this story. If you look in your mouth in the mirror and you see excess bone forming inside of your lower jaw, under your tongue, on one side and on the other side, they are kind of irregular bones. They're bumpy. They're not always very smooth, but they're kind of all kinds of shapes. If you can feel that inside your mouth and you look on the roof of your mouth, you see a bony prominence in the midline. I don't care how much time you spend denying it, your jaws are explaining that you are doing it explicitly. You may not know that you're doing it, but you are, your body is responding to it.
Thank you. What about mouth guards in grinding?
Well, yes, that's what the dentist will offer.
I just saw that in the chat box. She just wrote, the dentist prescribed a mouth guard.
Yes.
Yeah, because
what we'll do, that's why I said a dentist should not say to you they don't know what to do. A dentist will at least slow it down by giving you a mouth guard. A mouth guard, particularly if you are clenching more in the back. Most of the clenching occurs in the back, but in the front, gliding is what wears the teeth down. So if you go to the dentist and they prescribe to you an upper night guard, wear it. It is supposed to be a behavioral modifier. It modifies your behavior. It discourages you from clenching. Because when you have it in your mouth, it feels abnormal. It doesn't feel normal. So clenching with that in your mouth, you have to be exceptionally stressed to be able to clench through. Now, I've seen some patients that actually chewed through their night guard. So if they could chew through their night guard, you know what they will have done to their teeth. So night guard is very important. It does not cure the underlying cause. The underlying cause must be addressed. The night guard is just pretty much like a Band-Aid, as far as I'm concerned. Because if the underlying cause is underdeveloped jaw, and you do not correct that, the problem remains. I don't care what you put in there. So it's just a matter of time. If the patient chooses not to use the night guard anymore because it's crowding their tongue. Now that's another thing that some people will complain about, that, oh yeah, but when I put it in my mouth, I feel like it's choking me at night. But well, most of the time we do not have any part of the roof covered. So it's only the teeth that should be covered, so that when the teeth are clenching together, it will feel uncomfortable and the individual would not continue to clench.
You're right. Underlying problem always has to be addressed. But when talking about mouth guards, there are those over-the-counter mouth guards, and there are ones that are, made specially by, whoever the dentists refer people to. What's your comment, regarding this?
Yeah, I always tell people, if you get what you pay for. Customized occlusal guard, that's what we call it. Because you wear it at night, you can call it night guard. It's the best. If you don't do it properly, if you do it by yourself over the counter and it doesn't work well, it's not the fault of the material, it's just the fault of the person doing it. Because the way we do it in the dental setting is actually using a vacuum to suction the mold, to suction the material over the mold so that there is no pocket of air, so that it fits perfectly over the person's teeth. Now, if you can't do that with the one that you put in hot water and you mold and they ask you to bite into it, if you try to do that, you cannot endure the temperature that really is necessary to make a very smooth mold. So, like I said, you get what you pay for. For most places, I think a night guard without insurance, if you don't have any insurance, costs about $500. But for most dental insurance, they will pay a percentage of that. They may pay about maybe 50%, you pay 50%, and sometimes some insurance will pay 70%, you pay 30%. But at least it's necessary. Now, for most people, most insurance will require that we take pictures of your mouth to send with x-rays for prior authorization. So in case you go to a dentist and they say, we have to take picture of your teeth and you're protesting, well, your insurance will not approve it if they don't have those information.
They don't want to pay for anything anyway. So
we know that.
Dental insurance can be tricky. Dr. Oduyebo asked, or it says first, thanks, Dr. Ajagbe, for the wealth of knowledge shared. Please, what oral cavity muscle causes uncontrolled tongue biting? That's ouch. Biting the tongue is painful. And it says, is this action controllable?
Well, I can tell you, if you don't go for a checkup to know why you are biting the tongue, you will continue to bite the tongue. It's not that there's anything abnormal about the muscles. The problem is the space for the tongue is limited. All right. If your teeth are crowded and your teeth are tilted towards the tongue, that tongue is crowded in. There is no way you can chew without biting your tongue. All the teeth are supposed to be upright so that the tongue can have freedom to go up to the roof of the mouth when you are chewing and come back as you maneuver the tongue. But when your teeth are tilted towards the tongue, whether they are crooked or, that is, they are not all lined up, but they are tilted towards the tongue, you will always bite your tongue. It's the same way if your teeth are tilting towards your cheek, you will always bite your cheek. There is no other way. That's why the teeth have to be in their normal positions for the normal chewing to take place.
Thank you. Dr. Duyegbe wants to know how to get your contact. So can you please post that on the platform for participants who may want to contact you? And while you're doing that, I have a question.
Mm-hmm.
Cancer is like 1% of all cancers, very rare.
Mm-hmm.
But I just saw one not too long ago. What are the causes, and can we prevent this? Is it preventable?
Yeah, 1 second. I'm just trying to put, okay.
So, because the person that I saw that has the tongue cancer actually is not a smoker,
All right.
smoked, but has been exposed to cigarette smoke, but the person themselves have never smoked. So what are the causes? And again, I'll ask, is it preventable?
Well, like most cancers, the exact cause is not known, but there are causative agents that have been connected to them. Cigarette smoking is not primarily the one that causes oral cancer. People who use all kinds of oral, whatever, habits can cause irritation. Anything that can irritate the tongue can predispose it to pre-cancer as well as cancer. The commonest one that we know in literature is tobacco, ground tobacco like snuff dipping, the one that the Yorubas call taba. They ground, they mill the tobacco chewing, the one that the baseball players will put a bunch. You've seen baseball players, they will take a bunch of that, they put it in the corner of their cheek, and they, spit once in a while, that's the kind of habit. Those tobacco products are not just tobacco themselves, but there are so many things added to it, like limestone, like spices, all kinds of things have been mixed with those ground tobacco for them. I don't know what kind of benefits they are getting from it, other than the fact that it is terrible. It causes gum recession. It predisposes them to oral cancer. Now, if somebody doesn't do all of those things, I know in India, there's something that is called betel quid. It's another form of herbal product that they fold. They put it in their cheek, and over time, some of them will get cheek cancer or tongue cancer or gum cancer for that matter. So,
excuse me, what did you call it?
Betel quid. Betel quid. It's a BETL. Mm-hmm. So that's common in Asia. I mean, in India area. Other than that, from academic standpoint, we talk about sepsis That is somebody who has continuous, very poor hygiene. If you have enough burden of, bacteria can cause irritation of the gum. When somebody has non-healing ulcer, any non-healing ulcer can become a cancer. So if somebody continues to bite their tongue in the same place and the place continues to fungate, because it's a vicious cycle. When you bite your tongue, it becomes inflamed, and that is the same place that you're likely going to be chewing on every time you bite your tongue, because it's bigger than other parts of the tongue, and that'll be the first part to hit when somebody is going to bite their tongue again. So non-healing ulcer, chemical exposures from herbs or from any other kind of habits that people, develop can cause irritation of the tongue mucosa lining, and the floor of the mouth, and the floor of the mouth actually being very rich in blood vessel seems to be very forgiving for a long period of time, but at some point they are overcome. The immune response in the floor of the mouth can become overcome, and cancer can start from there and spread to the tongue.
Thank you. So, if there are no more questions, I'm going to ask Dr. Ajagbe to give us his closing remarks. This has been phenomenal. I'm surprised that our audience was quiet tonight. Dr. Ajagbe, you must have given us a shocker.
Well, somebody just posted a question.
Oh.
Oh.
Very Dr. Ajagbe. This is Dr. Booker. Thank you very much for your interesting article. And for those who don't know peripheral neuropathy, you don't wish it on your enemy. So also what they probably need to know is that the sensation in their foot is going to be less. So they should always wear shoes or slippers around the house. That's all. Thank you very much for this interesting topic.
Dr. Booker, welcome.
Thank you.
Thank you, Dr. Booker. That is important. I tried to explain peripheral neuropathy. Thank you for nailing it the way you did.
I have it.
Oh.
Not mildly, but I have it, so I know.
Wow. It's not funny. It's not fun. But, realizing that the oral cavity can cause, or problems with oral cavity in the mouth can cause peripheral neuropathy is new knowledge.
Right.
Our mouth is very important.
Absolutely.
So I have a question for you here. What is the cause of someone who wakes up in the morning with a sore on the tongue? Something happened overnight.
Absolutely.
Yeah.
Well, okay, so if you didn't bite your tongue before you went to sleep, the chances are that if you stop breathing at night and your brain wakes you up and you clumsily just kind of clench again because your tongue is beginning to go back to sleep, and you can bite your tongue. So there have been cases like that patients will wake up in the morning and they say, well, I found blood in my mouth and I found that it was from my tongue. So that could be a situation that somebody may have borderline sleep apnea or undiagnosed sleep apnea. And one of the ways by which they wake up, from being aroused from sleep is to clench or to grind their teeth so they can move their jaw forward. That might be the reason why they bite your tongue. Now, if you don't see blood and you just see a very painful ulcer, a very painful ulcer can occur under the surface of the tongue, not on the top of the tongue. They're under the surface of the tongue, just like it could occur in the cheek, in the floor of the mouth. That is what we call canker sore. The canker sore, nobody knows when it shows up. It will show up and it disappears unannounced. It will show up unannounced and it would also disappear unannounced. But when it's there, it is painful, very painful. So that's how you know it's canker sore. We call it aphthous ulcer in dentistry.
In medicine, we call it aphthous ulcer too. But it says on arousal in the morning is when this person notices, sore on the tongue. Could they have bitten their tongue in sleep? Is that somebody who is grinding? And
that's exactly what I explained. Exactly that. I said those who.
But that is not canker sore though. The biting.
No. I said that before.
Oh,
I said somebody who might be borderline sleep apneic, who is being aroused from sleep. I mean, from intermittent, respiratory arrest. That by the time they move their jaw forward, they're closing down with the tongue already falling back asleep, and they bite on their tongue. If there is bleeding, then it means they must have bitten their tongue. All right. If there is no blood, but they just saw ulcer, some kind of ulcer on their tongue, that's when I said it will be on the under surface of the tongue if it is aphthous ulcer.
Thank you. She said the edges of the tongue is where these sores are, and you only feel the pain when you wake up. Is that as a result of biting down while sleeping?
Yes.
Well, only on the edge.
Right. So that if you look at the edges of the tongue, the person should look in the mirror and see if your tongue has tooth impressions on it, like scallops, like somebody put some serrations on the edge of the tongue. You will know that your tongue does not have sufficient space, which means it's pushing against the teeth. And if you look closely, your lower teeth are tilting towards your tongue, and that in itself, anytime your tongue is at rest, if you are not conscious, the tongue will be between the two jaws. That is, the tongue can flow over the surface of the teeth in the back where you chew. And if you, by accident, even while talking, sometimes people bite their tongue. So if you wake up in the morning and the edge of your tongue is that way, you must have bitten it during the night.
I have a question. I'm not able to raise up my hand. I don't know why.
Okay,
thank you. Can I go?
Yes, please.
Thank you. Thank you again, Dr. O, for the platform.
Okay, I'll call you next. I'm sorry.
I'm so sorry. I wasn't able to raise my
Go
hand.
ahead.
I don't know why. Yeah.
Go ahead.
So Dr. Ajagbe, thanks again for the presentation. It's always nice to listen and hear different things about our mouth, dental hygiene. Is retainer the same as the mouth guard?
Okay. Retainer is used for those who have done some kind of braces, whether it is invisible aligners or the one that you call clear aligners or the regular braces. The reason dentists will give, or orthodontists will give retainer is to prevent the teeth from drifting back to where they used to. All right, the material used for that looks like the one that will be used for the night guard, but they are not the same. They're not the same in thickness, and they're not the same in toughness. So if you could use that temporarily, while if you can actually deters the person from clenching. If using the mouth, the retainer prevents them from clenching or grinding their teeth, maybe that serves the same purpose. But the materials are definitely different.
So another question. So for somebody that never did, that never
Braces.
wore braces, but the teeth is moving, so they can't use a retainer?
So what if you okay, so when you say can they not use retainer, anybody can use anything they want.
Okay.
However, what goal are they trying to accomplish? If the retainer means you are retaining the teeth in the present
condition,
the present state, the present location, whatever else, you can't do anything else. That's what retainer means. If you want to move the teeth to align them, then you have to do something that will move the teeth.
Okay.
So if your teeth are not lined up, but you say you are wearing a retainer, well, you're just keeping them the way they are, maintaining the status quo.
Okay. All right. Got it. Thank you.
Well, can you even get the retainer without it being prescribed?
Oh, it has to be prescribed. They mold your teeth and all that stuff. I was just
exactly.
Yeah.
So if you don't need it, they're not going to prescribe it.
Yeah.
So
No, it was when
I'm
Dr. Ajagbe said something about that for people that use braces is why they need retainers. So I just wanted to ask that for someone that has never used braces, but then the dentist or orthodontist prescribes a retainer, then does that make sense? Yeah.
No, it does. I've
Well,
never seen that.
Well, okay, let me clarify something.
Okay.
If you have severe gum disease, all right, if you have severe gum disease that it's been under control now, let's say you came to me and I looked at your mouth and I say, wow, you've had a very bad gum disease over the years. We can control it now. Within 2-3 weeks, we are able to control the spread of bone loss, spread of gum, infection. Then to maintain your teeth where they are, we can prescribe a retainer for you, which means your teeth will now be regarded as one. Once you wear the retainer, no tooth will be moving individually. So you can use it only to control, the bone loss. But it's not going to do any other thing for you. It's not going to straighten your teeth. It's not going to, build back the bone. It's just going to reduce, the mobility of the loose teeth that are already there. That's all.
Okay, thank you.
You're
I'll
welcome.
call you after the
Thank
conference call. I have more info and I have more questions.
No problem. Yeah.
All right, thanks. Thank you.
You're welcome. Bye.
Dr. Zugu, kindly unmute. Thank you. Welcome.
Welcome. Thank you, Dr. Ajagbe, for really bringing our attention again to peripheral neuropathy and also the dental connection or mouth connection.
Can you imagine?
I think also, it's really very important that we all pay attention to peripheral neuropathy and really understand the possible risks, because if you're at risk for it, you could have it. And the complication can be very bad, damage to the nerve and then loss of that extremity infection, all those things can really be really bad, even hands and all that. So, and what is interesting about it is that many a time when those who are having pain, they feel the pain, then they're screaming, they have pain. So then you go looking for it. A large percentage, almost close to 50%, may not even have any symptom. So identifying that you're at risk and screening for it becomes very important. And then protecting the nerves from damaging, and then doing what you need to do to prevent the condition from getting worse, such as, of course, treating the underlying condition, to allow the nerve protected, and then maybe it will regenerate or protect and improve. So please understand those risks. Now we all know that dental issue, mouth issue can be part of that too, and treat them for prevention. Thanks again. And sleep apnea is a mess of these situations too. So we should be aware of all these things. And I know we went through all the other risks, but sleep apnea can be a problem here. Thank you.
Yes, thank you.
Thank you. Thank you for mentioning sleep apnea. That's a huge one too. And Dr. Duyebo posted, is snoring a major symptom for diagnosing sleep apnea, or is this merely a reckless diagnosis? Good question.
All right, Dr. Duyebo, I can tell you now that maybe 70% of people that snore will deny that they do snore. But those who would not deny would say, well, I only snore occasionally when I'm tired. Well, until you do a sleep test, there is no way you can say you do not have a sleep apnea. And if somebody tells you you are snoring, you have a predisposition to having sleep apnea, well, take it seriously. I mean, if you're really a bad snorer. One of the things that we look out for in order for us to request sleep apnea in patients is your neck size. If you're a man, if your neck size is is above 17, definitely you are at a higher risk of having sleep apnea. Not just that your neck is about 17 and above, but if you have the fullness of a jowl, you have all these other things that accompany that. You look at your neck, you know you have a thick neck, and then the front of your neck is full. Not because you have a thyroid enlargement. That is a pointer to the fact that you may have the risk factor for sleep apnea. If your tongue is big, you look in the mirror and the tongue is pushing against the teeth, you know when you fall asleep, the tongue has nowhere else to go. If it rests, it cannot cling to the roof of the mouth. If it is at rest, it's more likely to fall to the back. And if it falls to the back and collapses with the soft palate, the part of the roof of the mouth that is soft, is way in the back. If that combines with the tongue and they push against the back wall, that can cause the intermittent, stoppage of breathing during sleep. And that's what is called sleep apnea, actually. Sleep apnea just means when you are sleeping, you are not breathing. So you can have occasional stopping, occasional partial breathing, but all of these things are monitored when you do a sleep test. And that is the only way you can know whether you have sleep apnea or not by guessing. And telling you that because you snore, you may have sleep apnea is not a reckless thing. It's something that somebody is drawing your attention to, something that may be very fatal. You should take it seriously.
Yes. Actually, to buttress what Dr. Ajagbe said, now people like me, primary care physicians, when we see patients and we think they may have sleep apnea and refer them for sleep study, if the only diagnosis is snoring, it is not approved by insurances for them to get the sleep apnea testing. They have to have other things like somebody tells them that they stop breathing during the night, like a partner or a spouse tells them that they stop breathing, or they wake up, scrambling, knowing that, they could not breathe and stuff like that. Or they have daytime sleepiness.
Exactly. That's what I was about to say, that if there is a report, that self-report, that you have excessive daytime sleepiness, that is, you are constantly drinking coffee to stay awake, you're on Red Bull, you drink 3 cans of Red Bull between 9 and 5, because you can't really stay awake. If you are left by yourself, you doze off. Those are signs that you may definitely have a sleep apnea.
That's right. Thank you so very much. So, Dr. Ajagbe, your concluding statements, what would you encourage us to
Well, take home
message? Thank
Yeah,
you.
the take-home message today is, well, the mouth is a gateway to the whole body. So the health of the mouth is the health of the whole body. If the mouth is not healthy, the whole body is not healthy. Whether it is the heart, the blood vessels, the brain, the heart, the kidneys, the pancreas, the nerves, everything, every part of our body is affected when there is gum infection. Every part of our body is affected. So we cannot afford to ignore one part of our gum that is swollen. It's been there for 2-3 weeks and we don't care about it. We say, well, at least I can chew on the other side. If you do, the problem is the infection from that one location is constantly going into the bloodstream. It's been found to be linked to atherosclerosis. So when people say, well, my cholesterol level is normal. Well, how come I have atherosclerosis? Look, you don't even know. If you've been having gum infection for so long and you've not been paying attention to it, say, this is how my grandfather's teeth look like this. My grandmother's teeth look like this. And so my teeth look like this. I think it's genetic. If you don't take care of the infection, there's wahala. There will be atherosclerosis down the line. Whether your cholesterol level is normal or not is irrelevant. There could be stroke down the line if the atherosclerosis continues to get worse, and then it spreads to many other blood vessels in the body. It can affect the brain, affect the kidney, affect even the liver. Peripheral neuropathy cannot be excluded from all of this. So we need to bear that in mind. And I think the easiest way, if we can follow that, I think it will save us a lot of trouble. Get baking soda, please. If you, I wish I can send baking soda to everybody. Buy baking soda. It's less than $2. Buy baking soda. It's less than the cost of a toothpaste. Even if you can't buy the big bottle of hydrogen peroxide, buy the one that is not even up to $1 from dollar store. Any hydrogen peroxide that is 3% is helpful. It will control your gum infection like you just flip a switch. Patients have gone several places to different dentists. Before I see them and I'm looking at them, I'm saying, what is wrong with this picture here? Saying they've done this, they give them chlorhexidine, they gave them that, they gave them that, but their mouth is still funky. Okay, well, let's do this. Humor me. I always tell them, can you humor me for 1 week? Get baking soda and hydrogen peroxide. They will come back to me in 2 weeks and say, I am so impressed. Thank you so much for letting me know about this. Some of them will remember their grandmother used to say that. Some of them will say, my great-grandmother used to say that. I say, well, you're hearing it again. Why don't you do it? So anybody on this forum tonight, the only problem is those who are in Nigeria or in Africa that may not be able to get the exact preparation. I don't know how to help you right now, but we're hoping that things will change very soon. The composition of hydrogen peroxide in Nigeria, I don't know. I don't think NAFDAC has been monitoring that, because the one I was exposed to was dangerous. It was too extreme. One was only water, no fizzing, nothing. The other one was, must have been a picric acid. Must be picric acid that they put in the bottle, and that's dangerous. So there is really no reason why anybody should be poisoned. So I'm scared to tell Nigerians to go use hydrogen peroxide when they don't know what the hydrogen peroxide should look like. Because I don't want to expose anybody to danger, because I've said it many times that it's good for their health, and now it's destroying their health. So that will be my parting words today. Please, let's be vigilant.
Dr. Ajagbe, thank you. I wish it would be your parting words, but I just got 2 questions. I don't know if there's a third one even. Maybe, well, but before I go there, Ifegbune says, thanks for a great topic that we are learning, and we are. Thank you. Ola said, thanks a million for the wealth of knowledge shared. And then there's someone who said, was using hydrogen peroxide, accidentally squirted it, and it went down the side of the throat. That, do they need to worry about that? It happened only once.
No. Please do not worry if you swallow a little bit of hydrogen peroxide. It's not going to kill you. Hydrogen peroxide does not kill anybody. Hydrogen peroxide will turn into water and oxygen. Once it's exposed to organic tissue, whether it is plant tissue or animal tissue, it will foam. Anytime hydrogen peroxide foams, it's already changing from the active ingredient of H2O2 to H2O and O2. Oxygen is what we need from hydrogen peroxide. We already know the byproduct will be water, but oxygen is what we really need to combat the bacteria that hate oxygen. And that is what Peripheral gingivalis is.
So, Attorney Morenike Oyenusi has opened a can of worms. Dr. Ajagbe, I'm going to give you 5 minutes to tell us this. She said, can you clarify what you were saying about antibacterial mouthwashes? She said she missed the episode in which you discussed it. And she said, her old dentist, who was from Eastern Europe, was always big on using hydrogen peroxide and salt with warm water as remedies for everything. Then Abraham Oyeleye asked, how do you use the baking soda? I'm lumping it all together because I know you can do it together.
Okay.
Another question says, how do we combine both to use? See, it's all the same question. How do you combine baking soda and hydrogen peroxide? I know you've said this on the platform. Please repeat that, and please repeat the issue with the mouthwashes, antibacterial mouthwashes. Thank you.
Okay. Antibacterial mouthwashes are the commercial mouthwashes. What they did was they compounded the solutions to destroy bacteria. Bacteria in the mouth, the most important targets were the strep mutans and the P. gingivalis. Those were the 2 that most of these bacteria, commercial products are targeting. There are other bacteria that are secondary that also will contribute to bad breath by the time they are breaking down the food that we eat, particularly proteins. So when this go on, when the antibacterial mouthwashes that are available in the market, when they are being used, they do not discriminate. They destroy not just the bad bacteria, they also reduce the population of the good bacteria. Now, the good bacteria are important. They are necessary for the control of our blood pressure. There is something called the nitrate, nitrite, nitric oxide pathway. That is, in our food, when we eat nitrate, we cannot use nitrate by itself in our body. The cells cannot take up nitrate and use it. So the bacteria in the mouth, the good bacteria in the mouth, will now convert the nitrate in our food into nitrite first. And then it would then be converted to nitric oxide. The nitric oxide is what we all need to survive. The nitric oxide is needed when when we are breathing in air from the sinuses. The nitric oxide will mix with the air going into the lungs to make sure the lungs capillaries, that is the very fine blood vessels, remain supple, very soft. They can expand to allow the carbon dioxide to come out and oxygen to go in. That same nitric oxide is needed for every function of our body system. Every part of our body needs nitric oxide. So with the mouthwash destroying the good bacteria, it's been found by research that the blood pressure goes up, even with 2 uses of the mouthwash. Now imagine somebody who is on antihypertensive and has been using mouthwash because they want their mouth to smell good, but their blood pressure is not being controlled. Now, we now know that the potential that, of the mouthwash causing the uncontrolled, hypertension is very high. Now, for those who want to know about the hydrogen peroxide and baking soda, it is very difficult to make it complicated. Let me just put it that way. It is so simple. So it will be too difficult for me to make it more complicated. Get your toothbrush, preferably not a toothbrush that is already spread out. The bristle should still be very good, that it can actually go between your teeth. When your toothbrush is already spread out flat, it's basically useless to you, so you might as well just change it. So let's make sure the toothbrush is good. Wet it in a running tap water. Shake it so it doesn't have a lot of water, because when you pick up the baking soda, fresh baking soda, pick up fresh baking soda. You can put it in your hand, you can use a spoon, you can, anything you want to use. Just take fresh one each time you want to use it. The ones that is remaining in the box, keep it in a Ziploc bag so it doesn't capture moisture from the air, all right? So you take the amount that you need to brush with. You brush with that first. Brush, 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 brush. It will not foam. The baking soda will not foam, but it's very gritty to start with. But within few seconds, it dissolves in your saliva. So it's not corrosive, it's not abrasive, it's nothing. So it's not going to wear down your teeth because you are using baking soda, okay? Now, once you brush your teeth and your tongue and you spit out, now you can put a little bit of hydrogen peroxide and swish around. When you begin to swish around, it starts foaming in your mouth. When it foams, it releases oxygen. As it releases oxygen, any bacteria that doesn't like oxygen that is growing under your gums begins to become paralyzed by the release of oxygen into the gum tissue. When it's not absorbed into the tissue, but it can perfuse between the teeth and the gum. That's where the bacteria, that are bad really hide. So once you do it that way, if you want, you can leave it, spit out as much of the foam as possible. Start swallowing your spit. It's okay. You're not going to contaminate yourself with anything. It's not dangerous to swallow, but I would not drink hydrogen peroxide because it will just foam inside your stomach. What do you need to foam inside your stomach for? So don't drink it. If you swallow a little bit of it, so be it. It's not going to kill. It's not a poisonous thing in that regard.
So question here. Thank you so much, Dr. Ajagbe, for saying that again. I've listened to you a few times on this and I do it differently. I just learned how to do it again properly. God help us. Because I squirt the hydrogen peroxide first and scoop the baking soda with my toothbrush and then brush I like the foaming with the baking soda together as someone.
Well, okay.
And then what's the hydrogen peroxide again to switch wash, and then
Well, okay, that's okay. If you want to do it that way, there is nothing against that.
no, that's more cumbersome. What you just
Well,
explained is better.
Well, I mean, okay, so let's say we want to reach a middle ground with you. If you have a cup, let's say you have a small cup that you put your hydrogen peroxide that you're going to use to switch into. You can use that to wet your toothbrush. You just shake excess and take the baking soda with it. And yes, you will get the foaming effect. If you like that effect, that's fine. But the simple, straightforward one is just wet your toothbrush, take some fresh baking soda each time. Don't use the one that you've used yesterday. Because if you left it open, it's already absorbed moisture from the air. And also absorb odor from the air. That's the reason you put baking soda inside your refrigerator. And it has a date timing. You have to put it for a period of time and you have to change it if you want it to be effective.
So somebody asked, what about the one, they said, what about the one they showed us? The Colgate baking soda and peroxide. You know, that toothpaste that has baking soda and peroxide. Colgate makes it. That's the one I used to use.
Well, I don't want to say too much about that. It's left to you. You want to spend your money, and you are free to spend your money whichever way. But if you don't do that, you're going to get the same, much better result because there is no sweetener in the baking soda and hydrogen peroxide. So every toothpaste has some kind of sweetener in
it. Can I say something quickly that
yes, please.
I have the baking soda toothpaste and I use baking soda just like I have those little cups. I pour it out for the morning and I dip in. And there's a big difference when you rub your tongue between the toothpaste and the original baking soda. Now, I must admit, I don't always use the hydrogen peroxide. But once you use the baking soda, your teeth feel so clean. Even the toothpaste doesn't get it as clean. I'm a believer in it.
Absolutely. I told you for almost 20 years now, I've stopped using regular toothpaste. The moment I was at Howard, if I may just share that briefly, and I used to mentor students for research. And every year I would take students to Piscataway, which is the world headquarters for Colgate-Palmolive. And usually we take about 5 students. Each of them will have a special research. One of the years was when I proposed the use of baking soda and hydrogen peroxide as an alternative to regular toothpaste. Well, we presented it at their world headquarters. Of course, it was received, but because they funded it, but they had put too much effort and money into producing the toothpaste. The original toothpaste, they've spent so much money and they were making money. Why change it when it's not broken? So that was the dilemma they were in. Until they now saw Arm & Hammer producing toothpaste. You know, Arm & Hammer originally has dominated the baking soda industry. So they said, this is working. Why can't we make toothpaste so we can take a piece of the market? I can assure you, whatever toothpaste you buy, there is certain standards they all want to follow. There's an ISO standard they must follow. If you're going to buy it, there are certain things that must be added to that toothpaste. So I don't need all those extra chemicals in my mouth or in my system. So baking soda works for me. It keeps my mouth fresh all day. If you brush your tongue properly with baking soda in the morning, I don't care if you drink sugar-rich coffee 3 times in the day. Your mouth would not be as bad as if you use only toothpaste to brush your mouth. So I know that for a fact. That is personal anecdote. Well, you can try it, humor me, try it and see what happens. Then you may choose to become somebody who would, you know, just defer to using baking soda. Huh? Well, I don't want to use the word believer, but anyway, if you just, you will be convinced that it is something that is good for you. Just like Dr. Buka just said, if you don't use both and see the difference, you may say, I mean, this is too cheap. I don't want cheap stuff. Well, I'll tell you the same thing I tell my patients. Some people say, oh, I just bought a toothbrush, a motorized toothbrush that costs $200, and I'm looking at them funny. So I asked them, so what are you trying to clean?
Mm-hmm.
What do you want to clean?
The teeth.
You just want to clean these teeth?
Yes.
Why do you want to use those power? And I just asked them the same kind of question. Do you use the same kind of scrubber you use for your car on your fine dishes? Just because you can afford the brush that they use to wash cars, do you want to use it to wash your dishes? Why? If they are delicate, they are very expensive. Why would you want to damage them with abrasives like that? Well, I'm not asking anybody not to buy Sonicare, whatever they want to spend their money on, they are free to do that. And the manufacturers are free to sell their products. But as a person, as a dentist, what do I use? I use simple toothbrush, medium. I don't even use hard. I don't use soft. I use medium because the bristles stay longer. The soft one is good. It's gentle on your gums, but it doesn't stay long. You know, it doesn't remain compact long enough. So medium works for me. So I use medium.
Question. Do we then rinse with water afterwards?
Yes, you may rinse with water.
After you put the hydrogen peroxide.
After the hydrogen peroxide.
I have another question that takes us to a little bit of a different dimension. What is the difference between the mouth guard and the mouth guard used for sleep apnea? Because this was prescribed to someone by the dentist, and it has a top, it's like denture on top of your actual teeth.
Well, okay, so
what's the difference?
They are very different. The one that for sleep apnea is not called mouth guard.
Okay.
That one is called mandibular advancing device. So that moves your lower jaw forward. That is supposed to pull the tongue forward with the lower jaw. So that's different. So if somebody has sleep apnea and their tongue is constantly going to the back because their lower jaw is small and it's trapped behind the upper jaw, what we then do is we separate the upper and the lower. We now bring the lower forward. We bring the lower forward so that the tongue comes with the lower jaw. And the two jaws are fixed in that position through the night. They're not going to be uncomfortable, but the airway remains open. So that's an alternate device to CPAP. For those who are not severe sleep apneic. Those who are severe sleep apneic, we do not tell them not to use CPAP. But those who are mild to moderate, they can use the mandibular advancement or advancing device just to open their airway, because that's the whole purpose of the CPAP. So that's the material also is different from the one used for just occlusal guard for those who grind or clench their teeth.
Thank you so much. Thank Thank you. That's very important to differentiate and to know.
Well,
So,
let me use this opportunity to also say that when I mentioned the ability to grow the jaw,
yeah,
it's not the same thing as the one that pulls the jaw forward. They are two different things. The one that pulls the jaw forward does not address the underlying cause. It just moves the tongue out of the way so air can go back and forth. That's what the one that I just described is all about. But the biomimetics, the one that is called biomimetic oral appliance therapy, that one actually grows the jaw. So for those who have very narrow upper jaw, deep and narrow roof of the mouth, well, that roof of the mouth can become flat, can be grown to become like this. Instead from being like a church steeple, they can actually be broad to create enough room for the tongue, as well as making it possible for the teeth to have enough space to spread out. So that one is a new technology, and that is, very important for anyone who has done every other thing except surgery. This one is non-invasive compared to surgery that actually breaks the jaw and grows the jaw with destructive, bone generation. They can use that technology, that surgical approach to open the airway. Other than that, the growing of the jaw is permanent. The surgery can fail. The surgery can, even just simple infection can make it to become totally a nightmare. But this growing of the jaw is non-invasive and has not showed any side effect. The side effect that has showed is good side effect, which means by growing the jaw, the teeth line up. That some people don't even need braces because their teeth just assume the right position as soon as they grow the jaw bone in 3 dimensions, the teeth fall into the right places and there is no more relapse. People who have their teeth grown in that regard and their jaw grown, they don't even need retainers. They don't even use retainers.
thank you. And you mentioned before, we're going to bring you back to come talk about the, growing of the jaw, because it helps also in sleep apnea that it can correct it for good. It helps in realigning the teeth, because after you use these braces and all, then you will need retainers. Otherwise, it's going to go back and that won't do it. So we'll bring you back. I don't know when because of line speakers, but you know how I grab you, when I need those feelings. So, and you still have other topics that we still need to discuss. Dr. Alan Olorunsola, said he's been listening while working on stuff, but this is very enriching. Thank you so much.
You're very welcome.
Okay. So, Dr. Ajagbe, thank you for another amazing informational session. I have learned a lot, and I know that a lot of people on the forum have learned it. And Haman from London said he joined late today, but found it interesting and practical. Thank you, Haman. We know it's in the morning there already. So till we meet again next week, please, folks, let's stay safe and protect ourselves from COVID and all these other viruses that are going around. Just being proactive in also avoiding crowded environments can be helpful at this time. So thank you. God bless you all.